Thank you all so much for being here today for our second Lunch and Learn event in our series for this year on reimagining work. If you don't know me and I haven't had a chance to meet you yet, my name is Jonathan Ingram, and I'm the Executive Director of Chattanooga Faith Work Culture. Chattanooga Faith Work Culture is a nonprofit in town that looks to help equip Christians to be agents of kingdom renewal in the places God calls you to be. Your job, your neighborhood, your home, with your family. And we really believe that not just what you do on Sunday is what your faith is about, but what it means for you to live that out Monday through Friday. And a big piece of that is the work that you do. And so the last couple years, as we think about work, a lot has changed. Many of you have been working not from an office anymore. Many of you have probably changed jobs in the last 2 years. And it's left a lot of space for people of faith and not to reimagine what it means to think about work and what meaningful work means. And so in this series, we're trying to think through what does it mean to, in light of the gospel, to reimagine the work that we're called to do. Today's topic is reimagining healthcare. I'm really thankful to have our speakers, who I'll introduce here in a second, be with us today. But I'm going to retroactively pray for the food you ate and for that you're eating. Pray for our time, and then we're going to get going. Sound good? All right. Well, Lord, thank you so much for this day. Thank you for each of these people who you brought here for some reason that you have for them today. Thank you for the time that they're carved out to be here. Lord, I thank you for our speakers that are going to be sharing. Lord, I just pray that you would show up in the conversations happening at the table and the conversations happening in the front. Lord, help us to know what it means to follow you in our daily lives. Give us a vision for what it means in the work you've called us to do, and empower us as we move forward. Bless this time we have today. It's your name we pray. Amen. So what we're going to do today is just have a conversation. And if you've been to any of our events before, our format is not changing. I'm just going to help keep this conversation moving, and a chance for you all to hear how our speakers who have thought about this topic a lot, where their heart is and on the issue of healthcare and what they've also been learning over the last couple years. We will have time for Q&A at the end. I think we're going to even have some interaction during our time. So be thinking of things that you want to know more about. What are things that you want them to speak about? And we'll have a little bit of time at the end for that. And I think we might have a little time to linger afterwards if you want to come up and say hello as well. But I'm so thankful to have Shannon Stephenson, who's the president of Cempa, with us today, and Dr. Michele Pickett, who is the executive director of LifeSpring. I'll let them, as they're going, they'll be sharing a little bit more about the work they do in healthcare, but I'm so thankful to have them. Can we give them a round of applause for being here with us? Well, I want to start with a question about your faith. So both of you are people of faith. You believe, you have a personal faith and believe in Jesus Christ. But what are some of the biblical values that have driven you in your work?
Hi, I'm Michele Pickett, in case you mix us up. I grew up in the Bahamas and became a Christian when I was I was baptized in the Anglican Church, and as I watched the Queen's funeral yesterday, but as a side, it really took me back to my beginnings and made me realize that God had a hand on me from way back then and had a plan. And when I became a Christian, when I professed my faith, let's put it that way, when I professed my faith at 13, I started going to a youth group, a Baptist youth group, and saw a movie with a missionary doctor in it. And that's when I said, that's what I want to be. I actually didn't really know what that meant or what I would have to go through to get there. But I really feel, I look back and call that a calling. And so the things that I think, the principles that God impressed on me are His compassionate love for people, particularly people who are in pain and hurting. And as we see Him in the Gospels, just touching and healing and listening to people who are physically hurting and healing not just their physical, but their whole selves, their whole beings. And so I think that's really the driving principle that kind of led me to do what I do.
Well, my story's a little different. I grew up in church. My grandfather was a Methodist minister. My great-grandfather was a Methodist minister, actually, of part of his family. And I asked, when we were asked about speaking, I said, can we be just vulnerable in this room? And he was like, please. So I am, and this is where you're going to have to go back to your word about judging people. We're going to leave that at the door, right? So 6 years ago, when I got into healthcare, I didn't have any idea what I was getting myself into. And it was a lot of tears driving to work and from work that changed my life. And my whole life, I feel like God has looked down and gone, are you going to do this, or are you going to let me step in? And I mean, I feel like we had that conversation again this morning, and we have it, every other day of, are you going to trust in me, or are you going to do this yourself? Because, I mean, you can do it. It's probably not going to be as good, but you can make a lot happen. Or are you going to step back and let me take the reins? And that has driven a lot of where I am today. So I brought some candy, and I wanted to ask some questions to you guys. So we're going to go on the King James Version. There's tons of different versions on the Bible. How many times is love talked about in the Word?
Like a word count?
Number of times.
2,000.
That is so close. 361 times love is written in the Bible. What about charity? Not near that many, guys. Just giving you heads up. A little overshot. We'll give you a little something. No, I'll throw the candy around afterwards. I won't hit anybody. That's not very loving. 24 times. So some of the things I think that we focus on as faith-based leaders and just people who are walking in faith is having to step back and recognize that this word here is not a weapon. This word is a map for us. It's for us to get grounded and rooted back into what we've been called to do. And what I feel like my relationship has taught me is that I'm just here to love people and then ask for a lot of grace. And that's really what led me to walk in the doors of Cempa Community Care, then at the time was Chattanooga Cares, and these people were hurting. There had been so much turmoil at the board level. The patients they weren't experiencing what they thought they should be experiencing. They just needed love, just like we all do. We all just need love. And so that's really where the Bible has helped me more than anything, is having to ask on a daily basis, Jesus, just let me love people and see them as you would see them, just so that I can be a blessing and I can live what you've called me to live.
That's so good. And we'll get more into faith as we go. It's just going to intertwine everything we talk about today. But can you just both kind of share why you're passionate about healthcare? You kind of mentioned it a little bit in what you said, but how did you get in this field? And kind of what drives the love that you have for this work? Because both of you give a lot to the work that you do in the areas that you're called.
Well, that's a very personal question, and I'm going to answer it. I feel the mission statement of LifeSpring is that we want to demonstrate the love of Christ, and that's why we run a pediatric clinic that holistically cares for children and their families and their community. That comes from my own experience of God's love for me, and a lot of brokenness in my family and in my body. I grew up in a family where my dad was an alcoholic and my brother was an alcoholic. We immigrated from the Bahamas when I was 15 in 10th grade from a private school in an island to a New York City public high school of 750 kids in one class, and left some trauma behind in the Bahamas as well. And then at the age of 28 was diagnosed with breast cancer. and since then have had breast cancer again on another side and ovarian cancer. In all of my trials, in all of my brokenness, Jesus' love was the realest, if that's a word, the most real thing to me and what has sustained me. And so as I do whatever I do, it's driven by the experience of his love. And I can't say that I wish any of those things away because of the relationship and the fellowship that they led me to, and that really is what keeps me going every day.
And just to kind of follow up with that, how many of us have parts that we just kind of wish people didn't have to see, right? And the beauty in having a relationship with Jesus Christ is that he loves you unconditionally. And aside from my dog, that's about it. That's all I've got going for me is, Jesus and Ollie. They love me unconditionally. Doesn't matter how much I fail, how much, what mistakes I've made. And that is what I love about healthcare is Cempa has embraced a model where we meet people where they are. We take all of their parts and needs and we just try to love them. And if we can't provide it for them, we try to get them connected with somebody who can. And think about some of the people that we serve. Right now, we're in the midst of this post-pandemic, whatever we want to call it. But 4 years ago, we started a harm reduction program where we are daily working with people who are still injecting drugs. But the success stories out of that program where a mother has gotten back on her feet, whether it was a car accident, they got addicted to pain meds, lost their family, lost their job, lost everything, and to turn that back around, what a beautiful calling that is. And the thing that we hear more than anything is, you just treated me like a person. So that to me, I feel that the healthcare field is probably the one area that does go full circle, right? So if somebody has healthcare problems going on, right? You want them treated, you want to treat that issue. Well, if they don't have a roof over their head, they don't have food to eat, they don't have a support system, they don't have transportation, they're not worried about taking that medication, right? They've got kids that they've got to support, or they've got to do this or do that. So there's a makeup that healthcare touches most parts of what people have going on in their lives. So that's what keeps me inspired on a daily basis, is the ability to be able to help people and just to share from some of my own experiences growing up. And we have some of the same stories. My father is a recovering alcoholic and who actually is bearing the consequence of that with stage 3 cirrhosis. However, he's sober, he's doing great, he's lost 100 pounds, and it's really only by the grace of God and having to even love him when I wanted not to, right? And having to see him through the eyes of Jesus. So I'm a talker, he'll have to just, but.
No, it's good. It's kind of going to my next question, and both of you are caring for, your organizations care for really a person, but families. And Michele, you started mentioning that a little bit. When you think about, we're not only holistically caring for a person when you're dealing with the health of them, what are the things that are coming into the office as a family unit, and what are some of the needs that are having to be met holistically with a family? Not looking for any specific story, but what are some of the things that you guys are picking up on that when someone walks in the door to LifeSpring, that you got a whole family there that you're having to care for at some level?
Everything. I mean, they walk in and they bring all of themselves. And I think our medical education has trained us to really focus on their physical and their physical need, or what we as medical professionals know, I mean, that they need. We can make a diagnosis and we can say, this is what you need to be healthy. But what they are bringing is everything. What conversation they had this morning, what arguments. Sometimes our patients bring their arguments into our waiting room. The conflict between parent and child, the conflicts between what the school says and what they see. So as a pediatrician, you very clearly understand that your patient's health is dependent on their environment and everything in their environment. And the more we study and more we realize the environment can even affect genetics and be generational. And so if we just focus on the physical, then I feel like we're not doing anything because, and you might argue that that's clear because of the disparities that we have a lot of physicians in Chattanooga, we have a lot of healthcare, but we still see disparities where African American families have a higher burden of disease. And so we're not doing something very well as a medical community. And I think part of it, in my small opinion, is that we are not looking at the whole person. We are not looking at their family. We're not looking at the community. And I think that, so when people walk into LifeSpring, our staff, by the grace of God, sees we try to see them and to try to address all of their needs, or I shouldn't say all, that sounds like we are all that great. Trust me, we're not. We're just trying very hard to share the love of Christ and to listen and to address whatever we can. And like Shannon says, if we can't do it, then we find someone else, and we have community health workers who connect and navigate the community. And we live in a community full of a lot of organizations like La Paz, and that we can refer people to when we are at an end.
I should have predicated this. I assume everyone knows that this is me speaking, not on behalf of my organization. But I'll tell you what I see time and time again, and what I feel like our staff sees, is trauma, brokenness, shame, guilt. We have a very tough time being vulnerable. And for those of you who are providers in this room, how many times did it take a couple visits to get something out of someone so you could really treat them for what really happened and what had gone on, right? And so I think it's a mixture of things. I'm not saying it's one particular thing, and I'm just going to go ahead and talk about some other uncomfortable things that we don't have conversations about. But this is a political climate that none of us really know how to handle. Religion is tough, right? It should be the answer, and a lot of times it deters people from seeking help because we all have to paint this picture that we've got it all together, and let's be honest, we just don't. So I think that really brings itself into the healthcare environment. If I could have a caseworker, behavioral health specialist for every single patient, every single staff member, for everyone, I would, because we have painted this picture that mental health, behavioral health is a bad thing. There's actually consequences sometimes to being diagnosed with a mental health disorder, right? But let me tell you, we've all been through some trauma, or we know somebody, or we've been part of it, or we've seen it. And those things can really take a toll on you in so many aspects. So I hope that we can integrate that better. The last thing, I mean, since I'm talking about everything uncomfortable, we have a lot of STDs in our country. And the latest statistic from CDC is that if you're under the age of 25, 1 in 2 have an STD, most don't know it because it's asymptomatic. And the scary thing is that with antibiotic resistance, we're not gonna be able to treat these things one day. Nobody wants to have those conversations, right? I mean, talk about, again, political climate, religious climate, but we're just talking about medicine and understanding the dynamics and what's at risk out there. And it's a huge risk. So, you know, being able to ask some of those questions and the different diverse populations that we serve, you mentioned some of the hardships in different communities. Well, different communities react differently, right? So some people bring their whole entire family in. Some people, they don't want anyone in their family to know anything about their medical history. So you have to kind of understand the dynamics of each diverse population that you serve.
Speaking of polarizing things that have happened in the last couple of years and trauma we've all felt, each of you talk about you have initiatives that you've been pursuing for years, but 2 years ago, the world kind of stopped as COVID became front and center for our world. And I know during COVID, both of your organizations grew a ton, and the scope of what you did changed and grew. I'd love if you'd be willing to share a little bit about how you grew, how you changed, what you learned, and what you learned about your patient. And some of that maybe even speaks to what you just talked about, how different demographics in the city respond differently to things. And so that's a big question, but what has the last 2 years meant for your organizations, and what have you learned, and how have you grown?
Can you start? Okay. Yeah, let's just get everything out. No, COVID hit, and obviously we are an infectious disease specialty practice, so our doctors were automatically looked to answer some of those calls, and granted, they were primarily working across the street at the hospital and dealing on the front lines of COVID. But what we had happen in our community was we saw a high rise in disproportionate populations for contracting COVID for various different reasons, okay? Well, testing happened, on riverfront at certain different areas. And what we found was that we had trusted partners in the community. And at that time, really, the health department wasn't necessarily one of them for everything. I'm not speaking ill will about the health department, wonderful resource, but we worked with them and said, hey, why don't we go take testing to the communities? So our mobile clinic turned into really an incident command bus. We took them out to communities, and we could not have done it without LifeSpring. Talk about people just tearing down walls that had been built up in Chattanooga for years, okay? The medical community, everybody did their own thing. They were the best at it, and they didn't need anybody else in their market. That's just kind of the mindset in the medical community. We saw that with some of the larger hospitals and other health centers. When COVID hit and our community was suffering, those walls went down. Everybody started working together, and it was beautiful. That's one of the scary things that I don't like seeing is those walls being built back, and I hope that that doesn't happen, but we took testing out to the community, meet people where they are. So some of the things that we lived by every single day, we actually were able to practice them, is meet people where they are. If this community needs it, take it to them.
Absolutely. I think we really feel like God prepared us for the pandemic. I'm looking at Jill, and I just remember the day it was declared, and I remember that Sunday night us meeting, the leadership meeting, and figuring out what our response would be. First of all, keep our staff safe. Second of all, make sure, or at the same time, keep our patients safe. By God's grace, we were scheduled to move into a Cempa building that April, if we hadn't, I don't know that we could have met either of those objectives. So I think a lot changed in how we provide care. Our staff still wears complete PPE, though some of it's optional as of last week, mainly the mask, but that was exhausting. So taking care of healthcare providers and nurses and our staff was one of the things that we really had to rise to the occasion to do, and I know you guys did too. I don't know where you got those little moon suits for us. But we realized also after we had made those steps that our community was not being given the education or access to testing, and we heard that they were doing pop-ups, so we joined forces with them and sent our staff out with them to do testing that whole summer. And as that came to an end, the pop-up testing came to an end, we decided to use our old building to provide testing to the community because it's in a community where they would have to go to Riverside Drive or to Alstom, and so we're on Macaulay Avenue in Glenwood, and we opened up the building until the police came because during the Delta surge, the line was going completely around the block by the Kangoo. And they said this is a traffic hazard. So we partnered with New City Fellowship, who allowed us to use their parking lot. So the partnerships are one of the things that came out of those, and New City's always been our partner, but we've never partnered with them in terms of providing direct service. And then a year later, when the vaccines came along, we're pediatrics, and so Jill is our vaccine guru. We receive vaccines from the federal government for children who are uninsured, so that they can receive their vaccines without cost. And so we know the system. And so she said we should sign up to get the COVID vaccine so that we can help. And even though there wasn't a vaccine for children in the beginning, we decided that that is why we named ourselves LifeSpring Community Health, and that we are committed to the community around the children. And so we started doing vaccine clinics February of 2020, 2021. And we continue to. Another partnership that Cempa is also a part of is with the city. We provide vaccines. They got a grant, and so we continue to provide vaccines 4 days a week. The library, Avondale Community Center, and at our office. And the numbers have gone up since the updated vaccine. We're really glad to say that. And we're still doing testing too.
Well, and I'll tell you, there are so many people in this room that were a huge impact, or somebody that you know was a huge impact during that. So, La Paz, how many events did we host together during the COVID surge and getting testing out in the community? And some of those beautiful partnerships with non-healthcare facilities was really amazing because, you know, when somebody has a trusted partner in the community, that's where they go and feel comfortable. So when they see you bring in somebody for testing, it's like, you know, is it okay? And so that was absolutely critical. And how many weekends did we call people back, right? So people wanted to know right away, right? Because their family was at risk, the people they love, they wanted to go somewhere, they wanted to do this. And there were just countless weekends where our staff worked around. I feel like you and I talked on the weekend, some on a Sunday, on a holiday. It didn't matter. We all just dove in and helped. And nobody cared about titles, nobody cared about which organization you represented. We were just all there to help our community. And even though it was such a tough thing to go through, some of those pieces you wish you could just mold and keep them going, because our community needs more of that.
We need that kind of collaboration around the disparities that COVID really illuminated, aggravated, so we are trying to continue those collaborations in a post-COVID, post-pandemic, which I don't really believe it's over, but post-pandemic world, those collaborations, I think, can be maximized to address some of the public health issues that we've known all along.
Yeah, that's definitely become apparent, is that there's been things that weren't brand new that are being exposed in new ways. And I would just love for both of you, because this is your world and it's not a surprise to you in a lot of ways, or to you, but both on a global level, but also a local Chattanooga level. I know we kind of talked about, maybe Shannon could speak more to the global side of that, but what are some of these things that, if you could do a magic wand, that we would see change in our healthcare system broadly, but also here in Chattanooga specific? And some of those have already been mentioned, but if we could talk a little bit more about that, that'd be great.
he's looking at me. I'll go first, but
You want to try the local, and I'll hit some global stuff? Maybe?
yeah, I mean, I think globally, I could say one sentence, I don't have solutions, but equity in access to healthcare across the globe is really something that I've been thinking about. And what equity looks like is that that means we have to provide innovative and thoughtful solutions to areas of the world where they just don't have the health that I feel like we could share with them. But anyways, I won't stick. Global is not my area. Local is really where I focus. And in Chattanooga, I really feel that an effort, I would love to see the medical community. I know there are a lot of believers in the medical community. I would love to see those collaborations grow so that we can actually begin to address together, not just from our ivory towers, but from the community. If LifeSpring, if God can use LifeSpring to do that, I would love to talk with anybody who has any thoughts and ideas about mobilizing really the church to be a part of healthcare from a community perspective, a community-centered focus.
Do you have any ideas about what that could look like?
They're not very formed. But I mean, I think that there are multiple organizations already, Cempa, Clínica Médicos, us, Volunteers in Medicine. There are several organizations already doing healthcare with either from a faith-based perspective or with faith-based people leading them. So I think just beginning to have conversations of what that might look like is as far as my thoughts have gotten.
So I think locally, one of the heroes that I've known since I was a little girl and who passed during COVID, Chris Ramsey, he loved our community and he had such a passion. And one of the things that in working with him and bringing Ladarius in, we found that a lot of the churches around here had a healthcare team as part of their church. So they worked together to start the Faith-Based Health and Wellness Council, and all these churches would meet and talk to each other. That's what we're going to have to do. And then looking on I'm going to really talk about on a national level and even maybe a state and regional level, our health systems have to talk. And I know that it's an issue. It all comes down to money, right? Somebody's profiting, somebody, but when you go from one provider to the next and you're having to send over all those medical records and you can't see when these labs were done and you can't see when this was done, and you don't see the historical data, you're having to ask all these questions again. I mean, what we're able to do with our iPhones and the technology that's out there, this is insane, right? You should know family history, you should know, and this is one of the things that I think Germany does a lot better than we do. Their health record is like a bank account, right? So you just go put your ATM, and what I'm imagining, you put your ATM card in, they know who you are, everything that you've got going on. Well, we don't have that here. Why? Because we're the best at everything, right? We're just so self-consumed with being the number one, being the most profitable. It's a capitalist type environment, right? But we have got to do a better job because people are suffering. Are we living longer? Yes. Are people living their best life? Maybe, but there's a lot of illnesses, and quite frankly, going back to the whole thing that's really the problem to begin with is how we're going to pay for it. Because when you live longer and all of these conditions that if people had engaged in primary care at a younger age, you probably would have caught, it's going to be very costly and taxing to our system in the future. So I think that that's what we have to look at is not the Band-Aid solution, but 5-10 years down the road, how do we make a system level change that can be more efficient, more effective, and save us some money?
I want to ask a faithy question again. it's easy to kind of talk and get our head around the idea of, okay, we need part of why we live out our faith is how we love everyone that walks in our office and care for that. Can you guys give some nitty-gritty ways that you think our faith should inform what it looks like in the healthcare profession to care for those that walk through the door? What are you seeing being done? And it could just be a small practice or something that speaks to that's motivated by a person's faith in Jesus, that drives what they do. I just think we oftentimes can say we're going to do it, and what we mean is, okay, we hope they get to know Jesus, and we want that, but what's it mean for the practical ways we serve when we're not evangelizing, when we're not, as we talk about in your place, you're not sharing your faith explicitly. What are those implicit ways, any in small ways that you've seen people live out their faith in the healthcare practice?
Well, I think we mentioned them already, and it's not very exciting or very complicated. As we experience God's love, how we treat our neighbor matters. How we see God's image in them matters. And I think that we have had patients say to us, you really care about us. I've never been to a doctor that listened to me and listened to or just even greeted me kindly in the front office. Sometimes it's as basic as that. So I know that things get incredibly crazy in doctors' offices with just there's a zillion things happening in that front office. They're getting calls from patients, they're getting patients walking through the door, the doctors are asking them questions, the nurses are asking them questions. It is probably the central place for aggravation. And so we've all been to doctors' offices where you walk in the door and you can tell the person behind the desk is having a bad day, and it comes out on you. So a very practical way of showing the love of Christ is being able to show love even in moments when it's not easy. And some of our patients are difficult. Some of our patients are struggling, and so they bring their struggles to us. And so learning how to love sometimes people who are hard to love, and not everybody's going to be really super thankful for us. And so how do you love in the difficult places is really where I think faith comes, where the rubber hits the road on a day-to-day basis.
How many of us had, especially I feel like you have those moments where you're praying and you're like, give me deeper roots, challenge me. And then you walk into a situation, you're like, I didn't mean that. Yeah, because the things that you experience and the way that you love people, it's tough, right? And just as she mentioned, people are coming in to your clinic every single day, but it's not different from what I think you guys probably experience on a day-to-day basis. And it's not even different from what you have to deal with at home, right? It's tough. People have circumstances, and I think that most of our patients just want to feel heard. And then I think one of the biggest instruments that I've seen is that when people can own a situation and just ask for a little grace, that to me is huge. I think that I need to do more and more of it, more than I probably do, and recognize that we don't all have the answers to everything. We're just all trying to make it. We're here, we're supposed to love and support each other. And I constantly am having to remind myself is if I truly believe, then I need to just step out of the way sometimes, right? And you're right, it's tough. It's tough in an environment. The beauty of our relationship, and many of you might not know, but our clinics, I'll say, Cempa could not exist as an FQHC lookalike, which is a federally qualified health center, without LifeSpring. 4 years ago, would we have ever thought that would happen, that you'd be on our campus? No, and that's the beauty of it. My organization is not a faith-based organization. It started out as an HIV clinic, and we still treat patients from diverse populations and of different beliefs, politically, socially, religion, you name it. We serve them all. And having to remind yourself that Jesus loves that person just as much as he loves me. It is not my place to intercede or place any judgment or question anything. I am just here to listen, to try to serve their needs the best that I can. And every time is an opportunity for me to learn something too.
Thank you guys so much for sharing today. Can we give them a round of applause? We have about 10 minutes or so for Q&A, so if there's any questions out there.
Doctor, you said just a few minutes ago you talked about barriers in the medical community. And I know the medical community is so specialized in so many ways, and sometimes it's hard to think past that 7 in the morning to the 7 at night, and then you start charting and all that kind of stuff. What do you see as, and don't tell me time, because I think we make time for what we want to do, but what do you see as maybe 2 or 3 of the key barriers, maybe in some of the more common medical part of the community that you're in? I mean, you're probably not going to be way down here in the orthopedics or something like that. It's going to be a little different, the surgical operating room. What do you see as maybe 2 or 3 barriers?
Barriers to the medical community actually coming together. I think, so it's interesting because I think Jill and I tried to start this ministry way back in the 90s, and it is difficult. So don't get me wrong, I am not judging the rest of the medical community, because what we did is it took so much energy. And so I think part of it is that it's not just time, it's energy. It's that we need to be able to provide a way that you can contribute if you're an orthopedist and you're and you're working 12 hours. If you're an OBGYN, we need to provide a way that you can give the amount of energy that you have available. I think one of the things that I realize why a lot of doctors don't do what we've done in terms of opening up a clinic is because it takes so much, and there's sacrifices. Our staff sacrifice a lot, and so perhaps we can figure out a way that we can allow people to give what they are able to give. And because I think even this goes with volunteers, I think volunteers get overwhelmed if they think that what we ask them to do is more than they can actually commit to. So can we find ways to engage the community in ways that they feel like they have the ability to do that? Does that answer your question?
Sure. So really, in what you're saying, if I can give an hour, for me, that's just as wonderful as the person that can give 5.
Right. And what we need to do,
take that step and do that.
we need to brainstorm and to work together about how to do that. And I think that that's really difficult in healthcare because so much of what we do is so highly skilled. And even though medical people are all highly skilled, our systems and our processes at LifeSpring are different from yours in your office or in the hospital or Cempa's. And so there's a whole training piece of getting up to speed. And so I'm interested in hearing from the community that's working in the hospital, working in their private practice, what is reasonable and how can we work together?
I'll just add in, it's interesting because I'm a very visionary person. I love hearing things and coming up with solutions. That is a very valuable thing to have, but something I always question, and I have to kind of go back to recognizing who I am and what I'm capable of, and I personally believe that I'm not capable of much without my faith. So I often ask, do I try to do too much? Do I, feel like the solutions are all there and not just trust the process? And what I mean by that is, are we sometimes too hard on ourselves in trying to identify and recognize, and we have to be champions, we need to lead this many souls to Christ, or we need to serve this many people, or we need to do this or do that. And I often wonder if we just even limit ourselves. Why not go into situations as you are, where you are, and let God use your gifts and talents to work together as a team? He already knows what's going to happen, right? I mean, he knew that we would be partners and that we would, have a building and be able to offer that building to your wonderful organization. And so it's almost empowering to me to understand that there is somebody greater than all of us that knows every single hair on our head. And you know what? He's got us. So let's go into situations knowing that we do have a victory, right? And so these are just opportunities, despite all the challenges and the hardships that you hear, because talking about healthcare is just not really fun, okay? It's not a fun topic. There's a lot of disparities. There's a lot of people hurt, and there's brokenness, there's disease, there's all these things. But there's a victory, right? And that victory isn't ours, but it's nice to know that at the end of the day, there is good that can come of everything if we'll just set ourselves down and let him work, right?
I would agree with that, and I think even if we share our story, and I think this is helpful for people who are thinking that God is calling them to do something. Often God gives us the vision, but it takes a long time for us to actually get there. I can't remember, I heard a preacher talk about when Moses saw the burning bush, how long it was before he actually went to Egypt, how long it was before God actually did his mission. And so, we talked about doing ministry back in the 90s. It wasn't until mid-2000s that we actually did a smaller ministry. We started talking, and I actually said no to you the first time.
I don't say that very well, by the way.
I can't even remember when, but I think it's just being obedient and listening, even if it's really small. And even if it seems insignificant at the time. I mean, we felt really insignificant when we were an after-school clinic. We saw a total of 200 kids for the entire year. But God takes that and he does what he had a plan. And so I think being faithful to answer in the small things and not being discouraged by those is really how we get to see him work.
Any other questions?
I have a question. So I'm a mental health provider, and I love that y'all both touched on that. I liked how you were describing kind of the systematic nature of what you're saying, and that you mentioned trauma. So I have a couple of questions. One, what are some of the mental and behavioral health needs that y'all are seeing within the population you're working with? And two, we've discussed barriers within what seems like the medical healthcare community, but as a private practice therapist, what are ways that we can step into this space that isn't just community mental health? Because I know that gets tricky. So.
We need a lot of you. Yeah. Well, and there are, but as a society, we have to break down the barrier that getting mental health looked at, behavioral health. I mean, I don't even love the terminology that we use, right? Because it already has a stigma attached to it that something's wrong with you, you're defected, or you had this, or you had that. And that's why I said, we've all been through something, or we've witnessed something, and there's just not enough of that to go around. Go back to the payer side, right? You only get so many visits for this diagnosis, so then you have to come up with that, and then you have to come up with this. By the time you get through digging into one thing, you've uncovered how many other things, right? And so how do we as a society embrace that and make it part of the healthcare environment? Make it part of your primary health care. It's typically just your annual visit. You know, are you suicidal? Are you this? Are you are that? No. Hey, how are you doing? You know, is there anything going on? Because stress can live and create so many and exacerbate so many other things. But we as a healthcare industry have to change that, and it's going to take a lot. It's going to be a very lofty goal to even try to obtain. You're going to have to get the payers on board with reimbursing for it. You're going to have to get the providers on board with encouraging it. You're going to have to get the staff members. I mean, we have tried to recruit LCSWs and LPNs, not LPNs, I'm sorry, LC, you probably, LPCs, thank you. It's tough, right? Because other organizations will hire them to work from home, pay them more than what we can pay them, and our community needs it. Some people need it every single week. Well, that's only how many slots per week? And we have 2,600 patients now. When I started, we had less than 700. I mean, if I could dedicate one person to each one of them, I'd have an entire building just for that. But I would, and I can tell you, I firmly believe the health outcomes would change a lot quicker.
Everything she said. And also, I mean, to answer you specifically, what are we seeing? We're seeing kids who are anxious, depressed, suicidal, more than ever before. We're seeing moms and parents who are stressed, anxious, and that is impacting their children. We are seeing children who need counseling, but there is no linguistically or culturally appropriate counseling to send them to. We're actually using Transformation Center in Cleveland to send kids for Spanish-speaking counseling. So so then that creates other barriers like transportation and parents getting their kids there. Even we use Uber Health, which is a way of we actually pay the bill for Uber to come and pick patients up to take them to the appointments. But every barrier you can think of is sort of in between our patients and behavioral health care. And then on top of that, there are families that we do those screenings and we say, here's a behavioral health referral, and they don't understand it, they don't believe it, they feel the stigma of it, and they often smile and say yes, but then they never follow through. And so we need to think of addressing the mental health issues of youth in different ways. And so we are actually, we actually just got funded to start a mental health initiative. I'd love to talk to you about it. But one of the things I really want to see us is be innovative.
So that's where I will challenge all of you. How can you help in your environment with people that are struggling, whether it's people you work with or people you serve or the people that are your customers? I'm sure there are representatives from every single field here. And I'll be honest, just being able to have those tough conversations, ask people how they're doing. I, for one, did not believe, I was a late believer in mental health issues, and my family was riddled with it my entire life. However, none of us are above or below anyone else, and where people are, we just need to give them what they need to be successful and to get things back on track. And I strongly believe that behavioral health is the future. I really do. I think that it has to be integrated at a very young age, and people need to be comfortable, because right now it's much easier to go to this thing and occupy your time and share your problems and get validation from other places, where we just really need to talk about our feelings sometime, and that is not comfortable, is it? So thank you for asking that questions, and I would just challenge each and every single one of you to think outside of the box on how you can be more supportive in your environments to get people the help they need.
You know, as that was a great question in our time, because it's a call to action to us. If you're in this room, most of you are a person of faith, and you are part of the church. And as we think about ways that we can be the light of Christ in the world around us, being a listening ear to someone is being the church. We talk about the church scattered, or the church gathered on Sunday, but you continue to be the church all week long, scattered in the places God calls you to be. And then my last thought on that is just like, thank you for what you do.
Thank you.
What you both do and what other medical providers in the room do, there's a pastoral element to your work. And thank you for that. And the church needs to honor that and pray for you all and support you in what you're up to. Steve Garber's an author I love. He says, knowledge implicates us. And if nothing else, we've been implicated to know the holistic nature of how healthcare affects a person, and as the body of Christ, what's it mean for us to move forward and move out?